Good morning. I'm Dr. Ari Deuk-Majan, CEO and founder of the Deuk Spine and Deuk Joint Institute. It's August 22nd, 2023. We are here with our first surgery for today, a patient who we tried to do his surgery actually a few weeks ago but failed because he had some issues respiratory-wise. We had to abort the surgery, bring him back, and try again today. This time we're going to secure the airway. We're doing the surgery under general anesthesia. Patient's completely out. This way we have full control of his airway and no surprises. Shot. So he has 3 bad discs, L3, 4, 4, 5, 5, 1. Plus he has facet joint pain. And today we're going to be treating the 3 discs and the facet joints. And the facet joints are going to be, what are they, bilateral?
Yes. Yes, sir.
Shot? All right, let's get an AP. They're bilateral. So he has back pain coming from discs, which are 85% of chronic back pain, and facets, which are 10% of chronic back pain. There is our very first drop of blood for the surgery. We'll probably end up losing about 20 drops of blood. That's about it. The surgery is pretty much a bloodless type surgery. Shot? That's 2. Let's see if we can get all 3 with 1 incision. Now the first step in this surgery, the Deuk laser disc repair, is to place these needles into the discs that we're going to fix. And the reason we're placing needles is they're going to serve as a pathway for me to get into the disc to fix it. Now these needles are just passing through the tissues. They're not hurting anything. They're not harming the muscles. They're not harming the bones or ligaments. Shot? They're quite literally just passing through the tissues. And what I'm going to do, shot, is I'm going to follow these needles with my instruments. The endoscope, the tube, the laser. Shot. 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 Now I'm entering the neuroforamen at L3-4. AP. I've already placed needles through the foramen at L4-5, L5-S1. Very good. You can see the bone spurs on the side of the spine. Those do not need to be removed. They're not causing any symptoms, but they're an indication of disease at these joints. All right, shot. No iodine, right?
No iodine. No omni.
Yeah. So this patient is allergic to iodine, therefore we don't have the typical drapes that contain iodine. Iodine is used in surgery a lot. It's very toxic to bacteria and other microorganisms like protozoans. So we use iodine quite a bit in our preps, in our drapes. But in this case, we're not using any iodine, and we're not going to be able to see the dye on the discogram either, because we're not putting any iodine in the dye. So you won't see the discogram with the usual tears that we see. We don't want this patient. Now, he may be fine with iodine that we use, but we don't want to take a chance, because if we're wrong and he has an allergic reaction to the iodine, he's going to end up with a bad allergic reaction, and he could have some serious problems during the surgery. So we don't want to take the chance of him having an allergic reaction to the iodine in the drapes or the medications we're using. So we've cut all the iodine out. How's vitals?
Very good.
Num num. All right, you can see we've lost literally 2 drops of blood the whole surgery. Dr. Berndes and I talked about his case because last time we had to abort. and we had to abort because we weren't happy with the respiratory performance during the surgery. And we don't want to take any risks unnecessarily. So we brought him back 2 weeks later, and we're doing the surgery under general anesthesia, meaning the patient is completely asleep. And we've got his airway and secure. This is the safest, best way to do it. It's a little more risky because now I have to navigate around the nerve roots without the benefit of the patient telling me I'm too close. Shot? Is that it? Normally, if I get too close to the nerve root, the patient will say, oh, there's pain in my leg. And then we have to make an adjustment. Look at the bone spur off the front of the spine. Just so you know, this is called DISH, diffuse idiopathic skeletal hyperostosis. Show them the 5-1 bone spur. See the arrow, guys? Look at the arrow. Go along the front of the vertebrae. No, that's not the front of it. Go to the front of the vertebrae, to the top of L5. Go back. That's not it. It's there. Now go straight down. No, don't go to the right. Go straight down. That's the front of the vertebrae. That line, that's too far back, but it's a little bit in front. No, there you go. That's the vertebrae. That's the normal front. Show them the bone spur. No, the one below at 5-1. Look at the beak. It's like a giant bird beak, okay? That's totally abnormal. We shouldn't see that. We're seeing it because this patient has DISH, diffuse idiopathic skeletal hyperostosis. Has nothing to do with his back pain. His back pain is coming from the discs and the facets. We're going to be able to treat that back pain effectively with the surgery. However, he does have DISH, which a lot of patients have, and there's really nothing to do about it. DISH is not treated surgically or medically at this time. It doesn't cause any problems usually. We don't do cosmetic spine surgery, as Dr. Berndes pointed out. That was his saying. I like it though, I've adopted it. By the way, I signed the contract to produce a movie here at Deuk Spine. I was talking to my team about it earlier today. You're gonna have to wait and see what it's about. I don't want to let the cat out of the hat too soon. But let's just say it's on a subject that needs to be talked about. I think of general interest. All right, we're inside the L5-S1 disc. You can see the blue dye has stained the degenerated nucleus or degenerated herniation. We're going to use our laser, which is the blue fiber, to clean up this annular tear and herniation. People ask me, are you doing a discectomy? The answer is no, we're not doing a discectomy. We're not removing the disc. We're just removing the herniation, and we're cleaning the tear, the annular tear. Oh, he's tight. Is he relaxed? He is. No twitch? He must just be collapsed. All right. So for the benefit of our audience, we're going to show you a video now, educational video on how these annular tears in the back of the disc, how they cause so much pain. There's a mechanism to it. We've worked it out at Deuk Spine Institute. We're the first in the world to really work it out. It has to do with an annular tear, and then a herniation, and then inflammation. And the inflammation just never goes away. The disc is trying to repair itself, but it can't. As a result, patients suffer with pain from the inflammation for years. At first, the pain is intermittent, and then it comes constantly. Sanjay, do you have the video?
Yes, Dr. Deuk.
Thanks.
Playing educational video in 3, 2,
All right, you've seen now from our video how an annular tear leads to a herniation leads to inflammation. And we have some very nice pictures of inflammation in the disc, right, Sanjay?
Yes, Dr. Duke.
Yeah, we took them last week. One of our patients had beautiful inflammation. He was the last surgery of the day on Thursday. If you want to go back and look at that video, you could see the pink inflammatory tissue. It's called granulation tissue. It's pink for a reason. You know, inflammation, of course, involves blood vessels and blood supply. So you could see the tear. You could see the inflammation. And it would be nice, Sanjay, if we could actually show the granulation tissue. Like if we could cut to that picture. We have to figure out a way to do that. We've never done that before. You know? If
Yes.
you could, you know how you switch feeds? You go from endoscope to the eye in the sky? It'd be nice if you could switch the feed to like a picture and show the granulation tissue. We should look into that and see if we can do that.
I'm not really sure about that at this time.
No, I don't mean right now, Sanjay. I mean in the future. Like work on it with Henry to figure it out.
Yes, Dr.
Yeah.
Duke.
So we could do it next time.
Yes.
So I want to introduce everybody to Sanjay. Sanjay is doing our broadcast today at Deuk Spine Institute. Sanjay joined Deuk Spine Institute about a month ago, and I've hired Sanjay to develop my AI platform for our new website, our digital human. Also, he's working with me on a computer vision project we haven't started, but that's in the future. And he's also backing up Jose and Henry. So, Sanjay, tell us about yourself. A little brief summary for the audience so they can learn about you. It's your first broadcast by yourself because Henry's in Orlando at the Work Comp Conference helping Becky and our team educate work comp adjusters and nurse case managers. Go ahead, Sanjay.
Hello, everyone. As Dr. Duke mentioned, my name is Sanjay. I'm a recent graduate from UCF in computer science, and I'll be working on AI, specifically on the medical data that is being provided to me. And it's just been 3 weeks since I started working. It's a great place to work.
Thank you. And what gets you excited every day, Sanjay?
It's the ongoing work and the kind of satisfaction that the patients show after the surgery. That gets me very excited.
Oh, good. That's the best thing. That's what gets me excited. Pioneering new frontiers in medicine and having incredible results, new technology, doing new things to help people. That's what gets me excited.
That's correct, Dr. Duke.
You know, there's lots of things you can do in life, but very few of them give you satisfaction of knowing that you've done good for society, right?
Yes, Dr. Duke.
All right. Fascinating. Look at all this. That's thickened ligament, by the way, that I'm treating right now. That's called the foraminal ligament. It's actually a piece of the ligamentum flavum, which you all know what the ligamentum flavum is. It's a ligament found within the spine to stabilize the spine. It's the first ligament that's removed when you do a laminectomy. That's why we don't want to do laminectomy. Laminectomy is destructive.
We have a question from Sharma on YouTube.
Hello, Sharma. Welcome to our live stream. Yes.
His question is, how hard is it to restore posture through surgery for a patient with ankylosing spondylitis?
Yes. Yes, so it's a very good question. This is about patients with ankylosing spondylitis and how hard is it to put posture back, to make the posture back to normal. It's impossible. That's what it is. Right now, today, it's impossible. Ankylosing spondylitis is an inflammatory disease that causes a fusion to happen to all of the bones and discs in the spine. It's done autofusion. The body fuses itself. The joints fuse themselves. It's a very rare condition and uncommon, and thank God. But once the spine fuses, there's no way to unfuse it. So the treatments really are geared towards preventing the fusion. Now, what causes the fusion is a severe inflammation, a severe inflammatory reaction. That's what causes it. So if you can eliminate the inflammation in the spine, in the discs, then you may be able to prevent ankylosing spondylitis fusion, autofusion. All right, we are just done. I've done everything I can at 5-1. But there's no way to fix ankylosing spondylitis. Sorry. No. Oh, right. No other irrigation? This needle poked me. Sorry, there's a needle on the floor?
Okay?
No, I just hit my lead. It was just clumsy. You get the needle?
Thank you.
Make sure you use gloves. Yeah, I remember now, we can't use our iodine because the patient may have an iodine allergy. So, I don't know.
No, we're good. Thank you.
All right, so one down. Next one, come on in. Guide wire. Great question. Any more questions, Sanjay?
We have a follow-up question from Sharma again on
Uh-huh.
YouTube.
Sure.
What are the risks involved in general anesthesia for a patient with ankylosing
Pressure.
spondylitis?
What are the risks involved for a patient under general anesthesia for a patient with ankylosing spondylitis?
That's correct.
The risks are the same for a patient with ankylosing spondylitis as they are for one without, except that ankylosing spondylitis can cause autofusion of the joints in the neck. Therefore, the patient with ankylosing spondylitis may have a fused neck, which makes intubation very difficult. Very difficult, because the anesthesiologist needs to extend the neck, and if you're trying to extend the neck in a patient with ankylosing spondylitis, you can fracture their bones if you try to extend it. So the actual risks are really during the induction and intubation phase, where the anesthesiologist is trying to put a tube in. And they may have to use, fiber optics. And then, of course, during extubation and recovery, when the anesthesiologist may have to re-intubate the patient. So it's really just the manipulation of the neck, if the neck is involved, and that's about it. Otherwise, it's the same risks as all other spine surgery. I think it's a little bloodier if you're working on the spine. But patients with ankylosing spondylitis, they don't get surgery on their spine unless they fracture their spine, which does happen, by the way. A lot of patients with ankylosing spondylitis fracture their spine. If they fall or have some type of trauma, it's very easy to fracture the spine in a patient with ankylosing spondylitis. I've had to treat a few ankylosing spondylitis fractures in my career early on. And you really have to do a long segment fusion around the fracture. You have to go up at least 3 levels and down 3 levels with your hardware and your fusion, you know, because there's so much force on that fulcrum where the fracture is, where the instability from the fracture is. So, but generally surgeons will stay away from operating on ankylosing spondylitis patients. I would operate on one if they needed disc surgery like this. If somebody had back pain from ankylosing spondylitis, they had facet joint pain or disc pain, then I would be happy to do this type of endoscopic surgery. But if I was an ankylosing spondylitis patient, I would avoid spinal fusions unless I had a fracture. All right. Have we shown the video yet on how the Deuk laser disc repair can repair the disc?
Not yet.
Let's show that video, Sanjay.
Playing educational video in 3, 2, 1.
Welcome back. Now you understand that the Deuk laser disc repair works by debridement of the annular tear. The annular tear, of course, is the source of back pain, neck pain, in 90% of patients. And this is the treatment that they need. This is the best treatment. It's the least invasive, fastest recovery, and most effective treatment, and it's safe. Very safe. As a matter of fact, in 17 years, I've had 0 complications from the surgery itself, my part as a surgeon. And we've had only 1 anesthesia complication, and we've had just 1 anesthesia complication. That's it. So it's a wonderful surgery. It's endoscopic, it's uniportal. There's a lot of biportal endoscopy being done over in Europe. I don't know, Luis, look at this. It's just a little twist of the tube and I lose the view. Is this company really doing a good job? I mean, I know we're using the scopes a lot more. As long as I don't do any manipulation of the tube, it's fine. But the moment I start to manipulate the tube, it becomes a problem.
We have a follow-up question from Sharma on YouTube.
Hello, Sharma.
His question is, what's the best course to take for a patient with ankylosing spondylitis with a grade 1 retrolisthesis L4 over L5 and a compression fracture at T12L1?
Yeah, that's a good question. You need to talk to your surgeon. I'm not going to give you advice on your specific case. That's not how it works. But talk to your surgeon. It all depends on the symptoms. This broadcast is not for getting a diagnosis and treatment plan. This broadcast is general knowledge and information, not specific for one patient. I can't give treatment advice without knowing more information. I'm not going to take more information on a specific patient here. This is not the right place for that. So talk to your surgeon and get their advice. Any other questions?
No questions?
All right, very good. Well, we are now operating on the L4-5. We've already finished the L5-S1. Where is this patient from? Wellington, Florida. All right, so he's a local. That's good. Well, everything is going well. You can see the discs are very degenerated. But we're getting everything cleaned out nicely. We're almost done with this disc. There's some granulation tissue. You see it? The pink stuff that I got rid of there? Sanjay?
Yes, we do.
It's a little blurry. I apologize. A lot of people think that this view that we're seeing is a big view. It's not. If you understand the tube that we're looking through is a little bit over 5 millimeters from side to side on the inside. On the outside it's 7 millimeters. So the view is not a big view. It's a very narrow view. More inflammation tissue over there, you saw it.
We have a question from Keynes25 on YouTube.
Good morning, Keynes25. Welcome.
His question is, patients after getting artificial discs implanted on the vertebrae, within just 2 years, the bone starts growing over the disc, trying to fuse. What makes this happen, sir?
So the question is about artificial discs, and a lot of people don't understand that artificial discs cause the bones to fuse sometimes. The answer is inflammation. Severe inflammation caused by the artificial disc and the surgery for the artificial disc. When they put an artificial disc in, they're actually grinding up the bone on the sides of the disc, the end plates. And that can cause the bones to fuse. Remember, what causes fusion is inflammation. So think about it. You're putting an artificial disc in. You're actually shoving bone behind the artificial disc, and you can actually cause nerve damage through the procedure. You can also cause fusion because you're shoving bone, and that bone is going to bridge in the disc space behind the disc and cause basically a bone graft for a fusion. So artificial discs should be avoided. Their adjacent segment rates are identical to fusion. They're not any better, which they're supposed to be better. Artificial discs were supposed to be done to keep movement. The whole point was to preserve movement. But now we're finding out that they actually cause fusion in a lot of patients. And the reason they cause fusion is the technique. It's so traumatic to the spine, and there's so much bone being pushed backward behind the disc that it meets up behind the disc and it causes a bridge to fuse. So it's just like doing a fusion. I wouldn't get an artificial disc. I stopped putting artificial discs in 15 years ago. I saw the problems that were happening the complications that were happening from other doctors on their patients. They were putting lots of them in, and I saw those complications, and I said, there's no reason. I'm not having any complications with my fusions. Why would I ever put an artificial disc that has far more complications? My fusions were getting a 1% complication rate. You know, loose screws, which are easy to go in and fix. Trouble swallowing, if it's cervical. So the complication rate for a good fusion is very low, far lower than artificial disc surgery. That's why I'd never recommend artificial discs. To me, artificial discs are just a scam, hype, dangerous and unnecessary. They really should go. Bye-bye. At least, yeah, artificial discs in the spine should really, they're not appropriate. A lot of little fragments. This surgery here is the best surgery in the world if you have a disc problem. Artificial discs are put in to treat disc problems. This surgery here is the best surgery in the world for a disc problem. Why would you want a piece of metal in your spine when you can just have the laser repair the disc? Why take the disc out? The disc is not the problem. The disc never causes pain. It's the annular tear that causes pain. As long as you can target the annular tear, there's no reason to put an artificial disc in. There's no reason to take your disc out. Artificial discs are overkill. It would be like if you had a snake in your kitchen, you drop a grenade in your kitchen and blow your kitchen up. You've caused so much damage to the kitchen that it's totally, it has to be renovated. That's why they put artificial discs. They're basically, the surgeon is doing so much damage to your disc that it has to be renovated with an artificial disc. The need for the artificial disc is because of the surgeon, because of the surgery they're doing. It's not because you need an artificial disc. That's the whole point. You don't need an artificial disc. You need your tear fixed. That's why we do the Deuk laser disc repair, because the tear can be fixed with the laser. But thanks. I know you know all these answers and you're asking for the benefit of others. Shot? All right, so we're going to do this next disc, and then we're going to be on to the DPR, Deuk plasma rhizotomy. By the way, for those of you who are real diehard Deuk spine fans, we now have a Deuk Joint Institute. It's for people with hip, knee, and shoulder problems. We are now treating hip, knee, and shoulder problems with a minimally invasive procedure called the Deuk plasma rhizotomy. It's done with a 3mm incision. If you have a knee pain and you need a replaced knee, we can fix it without replacing your knee. We can fix it with the Deuk plasma rhizotomy. Takes 15 minutes, outpatient, and you can be back to normal the next day with a mild soreness. You're on Tylenol, no narcotic painkillers, no opioids. Outpatient, no painkillers, and immediate relief of that pain permanently. It's called the Deuk plasma rhizotomy. We're about to do that procedure in a few minutes on this patient's facet joints. We're using it for facet pain, for sacroiliac joint pain, for knee pain, hip pain, and shoulder pain. So we did our first hip last week. The patient had 100% hip pain gone after surgery. She came back the next day. She was walking. She was so happy. She had been told by 3 surgeons she needed hip replacement. She didn't want to do it. She knew how dangerous it was. She said, nope, I'm going to wait for something better. And she did. She came here and got it done at Deuk Spine by Dr. Patel, Dr. Davis, our orthopedic surgeon, and myself. And she walked out of here. She had a little bit of pain with the procedure. She had to take some Tylenol afterwards, but the next day that hip pain that she had for all those years was gone. What a story. I mean, it's incredible what we're doing here at Deuk Spine in terms of advancing the technology of medicine. And it's shameful that other doctors aren't doing these things. They want to do the more expensive, more invasive surgeries. They're all being promoted by the implant companies. If these surgeons didn't have the implant companies over their shoulder during their entire training, they wouldn't be putting all this metal in patients. But they're basically being taught by the implant companies. The implant companies have taken control of the entire spine and orthopedic neurosurgeon educational system. They've become invested. Our educational systems are corrupt. They're taking money from these companies, and in exchange they're giving the companies exposure and access to their surgeons, their training. And I don't think the public would be very happy if they knew just how significant that relationship was in terms of how it affects the patients and their outcomes. Rather than getting a Deuk plasma rhizotomy for your knee or hip, surgeons are going to recommend knee replacement with a metal hip and metal knee, or a metal hip for hip replacement. And that's going to continue on for the next 30 years until the public becomes aware that there's a better, safer way to fix it at Deuk Spine Institute. And actually, sorry, Deuk Joint Institute. I got to get used to saying that myself. And why is it a spine surgeon had to figure out how to fix a joint properly, right? Berndes? Why did I have to be the one to discover how to fix a knee? Never been trained on knees. I did an orthopedic month of, internship, and I think I did some orthopedics for 3 months during my residency. But, 3 months of orthopedic training compared to all the years of orthopedic training of all the orthopedic surgeons in the world. What is that? What is that? That's not even David versus Goliath. That's... Yeah, well, why is it, why? How come I'm the one who has to discover these solutions for patients in fields that I'm not even an expert in? It's crazy. It's absolutely mind-boggling. People don't comprehend how significant that is. Right, Luis? Think about all the orthopedic surgeons that have been doing knee and hip replacements all these years. Right under their nose was the answer. Just under their nose. Literally under their nose. Right? And yet they never saw it. Why? Why is that? Why? You tell me why. Maybe they didn't want to see it. Maybe they want to do implants. Maybe they want to do metal because it pays well. That's the shocking thing about it. Well, it is what it is. All I can do is try to change it. All right, Sanjay. You have any comments, questions? This is our last disc. This is the 3-4. That's a piece of herniation right there. Every one of those is a piece of herniation. I keep grabbing them and pulling them out. Go ahead.
No questions?
Yeah, this disc is the softest of the discs. This disc is the softest of the discs. This is the freshest herniation of the three, okay? The other two discs, they were more degenerated. Oh, look at that piece. Oh yeah, it's Big Mama. Ah, it broke. What's up, Berndes? You're huffing and puffing over there like you just ran a marathon. What's going on? Huh? Your ankle is hurting you? Sorry to hear that. Have you been running too much? Have you had it checked out? Oh. That's better than a peritonitis. Right? Or an epididymitis. Oh man, that's a nice piece of herniation. I'm fishing out literally, I don't know, 20 pieces of herniation, maybe more so far. I mean, they just don't stop. This disc is definitely a newer, more recent trauma. Yes, it's trauma, for those of you who don't know. Herniated discs are trauma. They're traumatic injuries. And like all trauma, the body can try to heal it, but with a disc injury, they just can't heal it. And there's a reason for that. Its disc is very different than any other tissue in the body. It has very poor blood supply. And that poor blood supply of the disc is what keeps it from healing properly, to be quite honest. It's what keeps you in pain when you have a disc injury. The very poor blood supply. Good blood supply equals fast, robust healing. Bad blood supply equals slow, painful healing. Did you guys know that? Now you do.
No.
Huh? You need good blood supply to heal. It's one of the basic principles of medicine. Yeah, but we're not going to talk about that. Because there are no bacteria here. We don't want to freak people out. You got any more questions, Sanjay?
No questions.
That's it. Yeah, I mean, yeah. I mean, inflammation is necessary. Right? I know. I see that. I saw your article you sent me. Huh? Yeah, it's good. I mean, it's serological markers, right, for inflammation. Uh-huh. Yeah. Well, it's all inflammation. I've been saying that for 16, 17 years now. Inflammation, inflammation, inflammation. That's right. Right. I mean, it was right there under our noses, right? And yet we just didn't see it. Again, just like so many other things in healthcare. Makes you wonder why. You know, do you remember the Lord of the Rings movie? Who was the king? That he was, his eyes were glazed over, remember? And he wanted to sacrifice his son. He was under the influence of evil. That is exactly what this is. The surgeons, our eyes are glazed over. I like to believe that they're good at their heart. What was his name? Anybody? Come on. Yeah, he actually came and saved the people, the good people that were in the castle, being attacked by the orcs and goblins. Can't remember which one it was. Don't we have any Lord of the Ring or Hobbit or Fellowship of the Ring fans here? Huh? Yeah, the orcs and the goblins are the. No, the Sauron is the implant companies. No, they really are. I like them all. I like them all. I read those books as a kid. I mean, the movies I thought were good. I was very happy. Was it Peter Jackson that did the movies? All right. Sanjay, here's where we need your help. We need you to Google some of this stuff
Yes, doctor.
because your viewers are not helping you today.
Okay.
Normally, you know, they'll give us some answers while we're operating. But
Yeah.
today they're not very helpful. All right.
Oh yes, we have a comment from Steve on YouTube.
Yep.
He says Aragorn is the king. Haha.
Aragon. Aragon is the king? All right. Thank you.
And also a comment from T King on YouTube. He says King Theoden.
King Tyrion.
Yeah.
Perfect. So King Tyrion was under the spell of a evil sorcerer, right? And his eyes were glazed over. He was doing evil things. He wanted to sacrifice his son. All right? He was crazy. He was controlled. His mind was controlled. That's what these surgeons are. Their minds are being controlled by the implant companies. And instead of, you know, whatever the bad guy was next to the king, whispering in his ear the bad things and keeping him under control, poison, instead of that guy, you have the reps for the implant companies. They come, they take you out to the steak dinners. You should see it. I was just at the meeting here in Florida, and all the reps were there with their surgeons, taking them out to steak dinner. Nice dinners, buying them treats and toys to keep them hooked, addicted, you know, to using the implants. I had a neurosurgeon working for me that he had 3 different companies he was using every time he did fusion. He had the screws from one company, the screws and rods from one company, the cage from another company, and then another cage from another company. He was doing this to keep the reps happy. These reps were very attractive young ladies. And they made their commission based on him using their cages, screws, and rods. Same thing with orthopedics. The reps get a commission payment when the surgeon uses their knee, their artificial knee, or their artificial hip, or, you know, their cage in the spine. All these implants, these companies have reps. They're no different. If you're watching on Netflix right now, there's 2 Netflix documentaries. One of them is called Painkiller. Watch it. You'll see what I'm talking about. The other one is called The Pharmacist. Okay? The Pharmacist and Painkiller. They're both about the same thing. It's Purdue, and it has to do with OxyContin. All right? The reps would go around to the doctor's office and buy them lunch and smile and, you know, go in a skirt and show their body, all to get the surgeon, get the doctors to write more prescriptions for these narcotics. I'm telling you right now, this is the same thing with these companies. Holy shit, I realize that right now. You know that? It's the same. I kind of knew that,
Come on, please. Thank you. Just go above.
but I realize it more now than ever before. Fuck, man. I got to do a whistleblower. Now I got to find a whistleblower attorney. I need suction, ladies. All right, we're done. That's 2 discs. Now we're going to fix his facet joints. Remember, he was here 2 weeks ago. We started to do his surgery, and then We had to stop because he wasn't breathing well, and we had to abort, bring him back. That sometimes happens when you do sedation, conscious sedation. It doesn't work in everybody. You got to stop, and you got to bring the patient back and do general anesthesia, which is what we had to do. And that's why we're back here today doing the surgery. Okay, let's just go over the facets. Bilateral 3-4-4-5-5-1, correct? So let's get started. Shot? What is that? What did you do? What did you do, Luis? I mean, that's a very expensive laser. All right, that's 5, 4, 3. You agree that that's 3, right?
Yes, I agree.
I feel it, shot. I'm right on the transverse process. See where the needle is? Show us. Go ahead, Luis, do that, please. Yeah, see the needle there? Look at the transverse process. It's absolutely the most perfect spot. I need the knife here so I can get it.
Yes, sir.
Any questions from our audience?
We have a question from Keynes25.
Yep.
What are your thoughts on the barrier plant?
The what? Barricade?
Barrier implant
The barricade implant.
that supposedly holds a reherniation back?
It's my same thoughts as, what are your thoughts on Harry Potter's wand, that you can wave it and all the bad things in the world go away? Of course, it sounds great, but it doesn't work. It's a scam. I would never use the barricade. I have so many patients that came here, they had the barricade, and it didn't work. It's garbage. Look, here's the thing. I grew up believing you do what's right. You know, I'm from a different era. Most people don't know this type of thinking. I see it today. I go to Facebook, and there's someone robbing a store, and the store owner comes and gets a gun and chases them away, and then you see the reaction of people these days. It's, oh my God, she's just hungry. Don't chase her away. Let her steal. And it's like, really? People truly believe that it's okay to lie and cheat and steal? That's not how I was brought up. I was brought up that you have to be honest and you're not allowed to lie. If my dad caught me lying, he beat me. If he caught me stealing, he beat me. Okay? And you know what? I'm glad he did. I'm sorry if I upset people, but that's the right thing to do. You have a child who's lying and stealing, you don't beat him, but you spank him, you punish him. When I say beat me, sometimes I did get beaten, okay? And probably, maybe a little bit excessive, but whatever, you know? Point is, children need to be punished for doing what's wrong. It's the only way you're going to learn in life the right way to behave as an adult. Now, I do question that today, because I go online, I see people stealing with video cameras, and a lot of people in the public say, hey, let them steal. Let them go in and steal all that stuff. You know, don't punish them. Leave them. They need money. Okay, well, when I was taught when I needed money, I had to go earn it, not steal it. That's it, yeah. So here's the question. Am I wrong? Or are these other people wrong? Or are we all just right? You know, it's okay to lie, cheat, and steal, depending on your circumstances. Me personally, I was brought up old school. It's not okay to lie, cheat, and steal, ever, under any circumstances. So I'm a bit old-fashioned, okay? I'll admit that. But that said, the barricade device is 100%, in my opinion, garbage. It is fake. it doesn't work. It conceptually, yeah, it makes sense, right? It makes sense. It's just like prison, okay? Prison makes sense, doesn't it? Somebody breaks the law, you put them in prison, you put them in jail, okay? But the reality is, it doesn't work. Because nowadays in jail, they have drugs, gangs. Is that it?
Yes, that's correct.
They have everything they want. So in theory, putting somebody in jail or prison is supposed to work. But in reality, it doesn't. Because the system is broken. So in theory, the barricade device should work. But in reality, it just doesn't work. And so I don't recommend it for anybody. Now, if I was unscrupulous, I could lie to you and say, hey, yeah, we'll do the Deuk laser disc repair, and then we'll put the barricade device in at the end. Or, you know what, we'll do stem cells. We'll let your disc rebuild itself. But the truth is, the honest to God truth is that it doesn't work. Shot? I can't really see the TP that well. Why would you think that way would make it better? That's the opposite of where you need to go. All right, give us a moment while we're here looking for the transverse process. I mean, is that it there? I'm just above it? Is that right? Yeah. Shot? Too low. Damn. It's weird. The TP is a bit odd here. Let's try that. Shot? Seems like I could be a little bit higher.
We have a question coming from Gary on YouTube.
Give me a minute.
Sure.
At the top. Shot? So I guess what I'm trying to say to people is that, you know, if I'm aware of the barricade device, okay, and I know that it doesn't work, and I could tell people it works, and I could put it in at the end of these surgeries. Take your money. But I don't believe in taking people's money and not giving them something that's of value. I'm just old-fashioned. And I don't believe in doing unnecessary treatments that don't work. I'm just old-fashioned. Other doctors do unnecessary treatments that don't work all the time. These pain management doctors, they do these treatments all the time, epidural, facet, rhizotomy. They don't work. Shot? All right, I'm trying to get the last spot here. Shot? Jordan, can you make this a little better? I mean, you're off a bit. Shot? There we go. I'm sorry, what was was there another question?
Yes, Dr. Deuk. We have a question from
Shot?
Gary on YouTube. He says, Doctor, can you help someone if they got the disc implant and if and when goes bad?
Shot. Can I help someone who had the disc implant and it goes bad?
Yes.
Yes, yes.
And is there a procedure that you can do? I have a friend about to
Yeah.
have this surgery and tried to get him to you.
Don't let him have the surgery. That's number one. But yes, I fix people all the time. They come, they've had bad surgery by other doctors. We can still fix them. No problem, okay? It's just better if you avoid the bad surgery. Look at that, Jordan. 5, 4, 3. Perfect. I mean, literally, I hit the bone. We got 5 minutes, Dr. Berndes. Can we wake him up? All right. Yeah, so we can still help your friend. Even if he makes the mistake of having a disc replacement, okay? We can help anybody, even somebody who had laminectomy. I can still help them. Okay, even though they've had the laminectomy, I can still fix them. But the better not to have it done, because laminectomy removes your lamina and your ligaments and your facets, and it's bad. It doesn't fix back pain. Shot? All right, we're done with that one. Let's go to 4. So far, the surgery is going well for this patient. I'm happy for him. Shot. Dr. Berndes, you're a good man. You know, being willing to redo this for him under anesthesia. I don't tell my anesthesiologist how to do his anesthesia, usually. And he doesn't tell me how to do my surgery. Usually. But no, in all seriousness, I'm happy that Dr. Berndes was willing to take another stab at this and try to fix this gentleman, because his surgery is going really well. And I think he's going to do really well. All right, let's see 5. Shot? Yeah. Yeah, his son is here supporting him, and I really appreciate the son being here. Yeah, he wants a life. All right, I feel the bone. Shot. That's a tough one, Jordan. I think I need to be lower. Shot. Huh? Yeah, shot. No, one more and we're done. Are you ready to wake him up? Shot? All right. If you have questions, feel free, Shot, to write them up. A little bit too low. Just this L5 is weird. Shot. You can see you can see the pedicle there. Show us the pedi. Yeah, keep going. No, that's not the pedicle. You're talking about the TP. I want to see the pedicle. Show me the pedicle. It's right, no. It's a little to the left. Yes, that's the pedicle. So the target should be the top of the pedicle. Yep, right there. So I'm looking for the TP. Shot. Trying to get to the right spot. That looks pretty good, and I feel bone. So I'm going to take this. Remember, there's a lot of arthritis here, and that comes from these facet joints, inflammation. All right, that's three down, 1 to go. Great job, everybody. Thank you. Let's try to get the room turned over quickly. Shot. Wow. Shot. Show us what I'm aiming for so the audience can see. Shot. 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 Oh yeah, almost there. I feel bone. No, not quite. Shot. She hot. That's the foramen. Shot. Still the foramen. Shot. Shot. I'll get there one of these days. I think that's it. I think it's just moving, Sean. Yeah. You like it, Jordan? Spot on. Yes, indeed. All right. Done.
Lights on, please.
Great job, everybody. Thank you, Dr. Berndes. Thank you so much. Oh, by the way, take a look, folks. We've lost literally 5 drops of blood. 5 droppers. It's all right here. Can't hide it. This surgery, had I done the alternative, which is a fusion, that would have fixed the facets and the discs. The incision would be, you know, from here to here. Like literally 9 inches. Yeah, 9 inches. Yep. So instead, we've got an 8 millimeter incision and 3 millimeter incisions. I just want to say great job, everyone. Let's get the next case. We got 5 surgeries today for you all to watch. So what we got, the anterior cervical? Do we have a cervical or not? It's all lumbar? Huh?
We got 3
3 cervicals
cervicals.
today. Holy mackerel. We got 3 cervicals today. So you're in for a fun day. So these patients all have herniated discs in their neck. Now we got cervical next. All right. Sanjay, go ahead and play a testimonial, and I'll come answer questions.
Playing testimonial in 3, 2, 1.
Good morning, I'm Dr. Deuk Majan at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day. And I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or 2 sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm quarter-inch incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Deuk Machen, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions. And that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All right,
life.
thank you.
I'm Dr. Deuk Machen at the Deuk Spine Institute, here with a patient from Virginia who came out to the Deuk Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No.
Gone.
My back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months, and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back pain and give you quality of life back. What was life like living with that back pain?
any day you'd be like, it could happen today. I could go down with back pain, severe back pain for a week. And that happened. My first pain started about 5 years ago. I was working in the flower garden. I went down with severe pain. I was down for probably a month that time. And ever since then, it was just like randomly, just out of the blue, I'd go down for another week with severe back pain. It was just no way to live because I knew every day waking up it could happen today.
Yeah, it is no way to live because then you got to be careful every day. You don't set it off. You're worried about it. You're thinking about it. It takes control of your whole life, that back pain. His back pain happened to be coming from 2 discs. And did you see any other doctors? Did they recommend treatment for you in Virginia?
Yes, I was seeing chiropractors for the first number of years. The first chiropractor, he put me on this decompression table, and he would, pull you apart. I did that for 6 weeks. I felt a little relief at first, but it didn't last very long. And I've been seeing just regular chiropractors throughout the years as well. And then when this happened, I saw an ortho doctor. He did not recommend surgery. He recommended physical therapy. He said surgery it's like a coin toss. It either works or it doesn't. And that was not good enough for me. I needed a little bit more reassurance that it's going to work. That's when I started looking for other options. And I had a lot of time on my hands. I did a lot of research and I found Dr. Deuk here. And I started watching his videos and testimonials. Made up my mind right there. It was without a doubt that was my choice right there. I submitted my MRIs, and within 2 days I did my virtual consultation with you. And 10 days later I'm here. And it's amazing. I had an appointment with an orthopedic doctor in Charlottesville, and that was February the 2nd for my first visit, just for a consultation. And who knows how long it would have gone after that.
Years.
Yes, I'm done now. It's just I'm back to recovery.
Yeah, the problem is, unfortunately, the vast majority of doctors treating back pain don't know how to cure it. They just don't. And if I had to put a number on it, I'd say 99% do not know how to cure back pain. It really comes down to 2 things. You have to make the right diagnosis. Where is the pain coming from? Most doctors really don't even know it comes from the disc, and that's where it comes from about 90% of the time. Then the second problem is knowing how to treat it. And the treatment that works, the only treatment that works, is surgery on the herniation, really. And there's 2 surgeries that work, fusion and the Deuk laser disc repair. I've done fusions for years. I've cured people's back pain with spinal fusions, but that's a big, bloody, messy surgery with screws, rods, cages, long recovery. You're on opioid painkillers for months, like 3-6 months, just taking painkillers, just getting over the pain from the surgery. Not the back pain from the surgery. So when we started doing the laser surgery, people weren't having any back pain afterwards. They'd have just a little discomfort for one night. We realized they didn't even need the opioids anymore. So our laser patients don't get any painkillers except Tylenol and usually 1 or 2 Robaxin. So you did it. You happy you did it?
I'm very happy.
Yeah. And you can see in the surgery that we did, we actually got into your disc. We used the laser to clean up those tears at L4-5 and L5-S1. Surgery went really well for you. We didn't have any problems. It was just a tiny Band-Aid incision on your back, and that's why you went home an hour later, and that's why you're here today, ready to go home. Where are you guys heading back to Virginia?
This afternoon.
Driving?
No,
Flying?
we're flying.
Flying out of Orlando?
Orlando.
Awesome. Anything you want to say to your friends and family and people you know out there?
Yes, living in pain is hard. It's not a way to live. And I recommend Dr. Deuk any day.
Well, thank you. I appreciate that. You had faith, and you're going to be rewarded for that. Congratulations.
Thank you.
All right. Good to see you. Okay, I've had far worse than you, and they all do fine. All right.
Start.
Hi, Dr. Deuk Majan here, and I hope you enjoyed the lovely testimonial of one of our laser surgery patients who had back pain and had the Deuk laser disc repair done, again through an incision just that big, 7 millimeters. And through that incision, we basically take a tube, a metal tube that you saw, and we place it through the foramen, called transforaminal, where we're able to attack and remove the herniation and clean the annular tear. Surgery went very well. There were no problems. And we also did his facet joints, and we did the Deuk plasma rhizotomy to treat the facet pain. So he had both disc pain and facet pain on both sides for the facets. We did a bilateral facet rhizotomy with the Deuk plasma rhizotomy. We did the discs at L3-4-4-5-5-1. All right, do we have any questions?
Yes, we have a question from Agent of Truth on YouTube.
I like the name, Agent of Truth.
Are you able to help patients with previous superior implant that is still installed?
Yes. Are we able to help patients with a previous superior implant, I believe is what you're asking. That's the interspinous device. Yes, we can. Absolutely. We do it all the time. Unfortunately, we do it all the time. The truth is we get a lot of patients that have had barricade devices, mild procedures, superior devices, intercept devices. I mean, all of these devices, they don't work. Spinal cord stimulators, they just don't work, or they don't last. And we could still fix you. So what we're going to need is an MRI scan in the last year, year and a half, and then go to our website, mri.deukspine.com, and we'll do a free MRI review for you virtually. We'll spend 10 minutes with you, and I'll go over what's wrong and how to fix it.
A follow-up question from Agent of Truth again. What about a patient with a previous fusion?
Yes, go ahead and write mri.deukspine.com in the dialog box. Yes, we can definitely help people with previous fusions. It turns out when you get a fusion, as long as the fusion was done well and the bones are fused and there's no real issue with the fusion like infection or pseudoarthrosis, as long as your fusion's good, then the pain never comes from the fusion, period. A lot of people think the pain comes from screws, rods. It doesn't. It comes from the disc or facet joint above your fusion or the joints below the fusion. And it's so easy to figure out. We could do it literally in 2 seconds. I could figure out where your pain's coming from. And that's really the key to a successful treatment, is understanding where the pain's coming from. If you've had a fusion at L5-S1 and your pain is below the L5-S1, well, there's no disc below L5-S1. All that's down there is the sacrum and the sacroiliac joints. So if you have an L5-S1 fusion, the most likely cause of your pain, if it's below the fusion, is the sacroiliac joints. And those SI joints we can treat with the Deuk plasma rhizotomy. Those are your SI joints. That's a fusion. And if you fused at 5-1 right here, the SI joints become the most likely candidate for pain. They're below your fusion. On the other hand, if you have an L5-S1 fusion and you're having pain above your fusion, then the most likely candidate is the adjacent disc or adjacent facets. Again, both very easy to fix. So yes, even if you've had a prior fusion, don't worry about it. Fill out the MRI review and do your free MRI review. You get 10 minutes with me. I'll figure out exactly what's wrong, and I'll tell you exactly what needs to be done to fix it. But it probably is not the fusion.
Follow-up question from Agent of Truth again on YouTube.
You're on fire, Agent of Truth. Agent of Fire is what we'll call you.
My dad had a fusion and has a broken screw. Is that a problem that can be corrected?
Yeah. So broken screws with fusion, can it be corrected? Very common problem. Typically, you get a broken screw. I hate to say this, as a 50-50. Half the time it's the surgeon didn't do the fusion right. The other half the time the patient got a little too physical with activity, and they did something, they fell, or they, usually falling, and they broke the screw. Screws are not meant to last forever. Screws are tested with a million cycles during their biomechanical testing. When the company that manufactures them, they manufacture the screw, they put it in a spine, and then they do cycles, like a million cycles to test it. And if the screws last a million cycles without breaking, then usually the FDA will approve it. So there are a lot of screws out there that are approved. However, they are not appropriate for the size of the patient. If you have a really big patient, or if you have a patient that is going to be falling, you want to use as big of a screw as possible. If you use a skinny little screw, that skinny screw is going to snap, and that sometimes could be the reason. The other reason is if you put in a small cage and the cage isn't big enough, or you don't prepare the disc space properly and put a giant cage in, you can get a fractured screw as well. It's complicated biomechanics, but it has to do with load sharing and reconstruction of the anterior middle column. But the point is, it doesn't matter. We can still fix the pain. Now, a lot of times when you get a broken screw, the tip has to stay in. You can remove the back, but the tip will never come out. The tip doesn't cause problems, leave it alone. But basically, you need a diagnosis as to what's causing the symptoms.
I think that's all the questions that we had.
All right, thanks for joining us. Our next patient will be a 2-level cervical Deuk laser disc repair. He's got 2 big herniated discs, and we're going to go in and fix both of them. And then the one after him will be either another cervical, or it could be our lumbar patient. We have a patient who's come from out of town. He has had amputations done on his arms, and he's having horrible back pain, and we're going to fix his back. The only concern, though, is that he's got bad IV access. A lot of his veins are scarred up, so we've got to look and see, can we get IV access on him. We got a full day today, a lot of surgery, so you're welcome to join